Welcome. You're tuning into our deep dive, and this one's really geared towards you if you're looking at the ORE Part 1 exam.
That's right.
We know you probably want to get a solid understanding, a clear picture of what this prep course is all about.
And crucially, how it can help you, succeed in UK dental practice.
Exactly. So, our aim today, pretty simple, really.
Yeah, just a concise welcome, an overview of the ORE Part 1 UK dental preparation course. We're drawing on the available info.
Think of it as your first look, highlighting the main things you'll cover.
And you see straight away, it's broad, it covers a lot.
It really does. It's designed to immerse you in, well, everything essential for safe, effective dental practice here in the UK.
Which is obviously key for the exam itself.
Absolutely. So we'll touch on the main modules, the sort of principles behind the course.
Just to give you that solid foundation, that initial understanding of the journey ahead.
Okay, let's jump in then. The core aspect, maybe the core aspect, is applying dental knowledge specifically within the UK context.
Right. It's not just the science in isolation.
No, it's how it applies day to day under UK guidelines, UK regulations.
And that focus on UK guidelines, on developing skills for safe patient care, maybe within the NHS framework, that's constant. You'll see it pop up again and again.
It's a real central theme.
Mm-hmm.
You see it when you look at the modules,
Yeah.
like analgesia, anesthesia, and sedation.
Yeah.
It's not just here are the types of local anesthesia. It's very much focused on preventing and managing complications, specifically in a UK setting.
And that connects, doesn't it, to the next bit, anatomy.
Definitely.
Because here you need a really, really thorough understanding. Cranial nerves, obviously.
Crucial.
Head and neck muscles, the nerves, the blood vessels, even the TMJ salivary glands.
And the course really stresses why this is so critical. Think about local anesthesia again. Knowing that anatomy inside out isn't just academic. It's fundamental for getting it right. And, maybe more importantly, for avoiding problems, like hitting a nerve or a blood vessel.
Which is a huge focus in UK training, yeah. It makes you think, how's your detailed head and neck anatomy right now? It really is foundational.
It underpins so much else.
Okay, so after anatomy, we've got biochemistry.
Which might sound a bit abstract, maybe?
A little, perhaps, but it directly explains what you see in the clinic.
Like the actual biochemical stuff happening in teeth and gums. Enamel, dentin.
Yeah, how hard tissues form, the role of enzymes, proteins, carbs, and oral health. Even metabolism, nutrition, how that impacts the mouth.
So the takeaway is understanding the why behind things like caries or how saliva works.
And how you manage those according to UK protocols. It's fascinating how it links up.
Okay, what about dental materials? The UK context seems important there, too.
Oh, definitely. So, yeah, it covers the properties of composites, amalgam, glass ionomers, the usual suspects.
But then it digs into the clinical side. Safety, biocompatibility, how the body tolerates them.
And even UK rules for storage, setting reactions, adhesion science.
So it's practical. It's about making evidence-based choices using these materials safely, effectively, according to UK standards.
Exactly that. You need to know how to use them here.
Gotcha. Then embryology. Development of the face, mouth, teeth.
You might wonder, why do I need this?
Right.
But understanding normal development is actually crucial for spotting when things haven't developed normally. Congenital anomalies you might see in UK patients.
So it provides context for certain conditions.
Okay.
Endodontics. Root canals.
Diagnosing pulp and periapical issues, using the right instruments, the right irrigants. Again, UK standards are emphasized.
Working length, obturation techniques.
It's all geared towards thorough cleaning, disinfection. That's the goal. A cornerstone of UK endo practice.
Makes sense. Successful endo needs precision, following best practices.
And many of those are set out in UK guidelines. Okay, then there's general medicine.
Which is huge, obviously, understanding the patient's whole health picture.
Absolutely. So it covers cardiovascular, respiratory, endocrine conditions, things relevant to dental treatment in the UK.
And critically, how you might need to change your dental plan for patients with these conditions.
All while sticking to UK medical guidelines. It poses a question, really. How comfortable are you managing medically complex patients according to UK ways? This module helps build that confidence.
Very important. Then histology, the microscopic view.
Yeah, zooming right in on oral tissues, bone, connective tissue, mucosa, epithelium, how teeth develop at a cellular level.
And that helps you tell normal from pathological tissue, right? Like in biopsies.
Precisely. It's the micro-level detail. After that, laws and ethics. Can't practice without this.
Definitely not in the UK.
Yeah.
Consent, confidentiality.
Has specific regulations, the GDC standards, General Dental Council.
It's the foundation of being a professional dentist here, isn't it?
It absolutely is. It's not just rules, it's your responsibility. Then microbiology.
Infection control. Big deal in UK dentistry.
Huge. Cross-infection protocols, the oral flora, plaque, pathogens relevant to UK practice, protecting patients, protecting yourself.
Non-negotiable. The UK standards here are strict.
They have to be. Okay, operative conservative dentistry. This is bread and butter stuff. Fillings, restorations.
Yeah, managing failed restorations, dealing with deep caries using UK evidence-based approaches.
Principles of cavity prep, both traditional and, importantly, minimally invasive.
Restorative materials, again, techniques used in the UK. That minimally invasive focus is key now, isn't it?
Very much so. Then oral medicine. Diagnosing and managing things on the oral mucosa ulcers, lesions.
Following UK guidelines, naturally, and spotting oral signs of systemic disease.
Yes, knowing when to refer on. That's a vital skill in the UK system. Oral surgery next.
Impact to teeth, extractions.
Managing medical conditions in surgical patients, post-op care, infection control again, principles of exodontia, handling complications.
All within UK standards and context. Safe surgery demands following protocols.
Exactly. Orthodontics is introduced too. Appliances, treatment planning basics.
Malocclusion classification, jaw growth, stuff relevant for general practice in the UK.
Even if you don't specialize, you need a basic grasp for referrals, right?
Absolutely. Pediatric dentistry kids.
Child development, behavior management, UK guidelines on that. Managing trauma, pulp therapy in primary teeth.
Again, UK best practices are the focus. It's a specific skill set for treating children.
Then periodontics, gum disease.
Gingivitis, periodontitis diagnosis, risk factors management.
All following UK guidelines, non-surgical, surgical therapy based on UK evidence. It stresses a systematic approach.
Consistent with current UK best practice.
Right?
Nearly there. Pharmacology.
Prescribing antibiotics, analgesics, safely and effectively according to UK guidelines.
Drug interactions too. Local anesthesia agents again. How drugs work in the body, pharmacokinetics, pharmacodynamics.
Appropriate prescribing is a massive responsibility in the UK. This module gives you that essential knowledge.
Physiology. The body's basics.
Cardiovascular, respiratory, neurophysiology like pain pathways, reflexes, saliva too, its role, composition.
Understanding this underpins so much, especially with medically complex patients here.
Definitely. Preventative and community dentistry highlights the UK's focus on prevention.
Curies risk assessment, fluoride use, oral hygiene instruction based on UK guidelines.
Public health programs, the dental index is used in the UK. Prevention is absolutely key here.
A cornerstone, you could say. Prosthodontics, dentures, crowns, bridges.
Yep. Complete and partial denture design, fixed pros, crown preps, UK standards and techniques, occlusion, articulators.
So replacing missing teeth functionally, aesthetically, following UK practices. Radiology.
Interpreting radiographs systematically, and radiation physics, safety.
Crucial for diagnosis and planning everywhere, including the UK. And finally, syndromes.
Introduces craniofacial syndromes, genetic conditions with oral signs.
Clinical features, multidisciplinary management in the UK.
So recognizing these is part of providing comprehensive care here.
Wow. Okay, so it's clear this ORE Part 1 prep course is really comprehensive. It's built to give you that knowledge and understanding needed for safe, effective UK practice.
Yeah, and that recurring theme, that constant emphasis. UK-specific guidelines, UK best practices, and what the ORE exam demands.
It's certainly a lot to take in, but hopefully this overview gives you a really solid starting point as you start digging into these areas for your UK journey.
So thinking about everything we've just touched on, what areas for you personally feel like you might already have a good handle on, and which ones seem like they'll need the most focused effort as you prepare for ORE Part 1 and practicing here in the UK? Something to think about.